How does a urethral stricture impact urethra function? Imagine trying to flow water through a garden hose that has a kink or a narrow spot. That's similar to what happens when someone has a urethral stricture. A urethral stricture is a narrowing of the tube that carries urine from the bladder to outside the body. This narrowing happens because scar tissue forms inside the urethra, often after injury, infection, or inflammation. The scar tissue blocks or restricts the normal flow of urine, making urination more difficult and sometimes painful. When the urethra becomes narrow, the resistance to urine flow increases. This can cause a weak or slow stream of urine, and in some cases, the person might have to strain or push hard to urinate. Sometimes the bladder doesn't empty completely, which can lead to a feeling of incomplete urination. In severe cases, the narrowing becomes so tight that the person cannot urinate at all, which is called urinary retention and requires emergency medical attention. Chronic blockage of urine flow puts extra pressure on the bladder muscles. Over time, this can cause the bladder wall to thicken and become less flexible. The bladder may develop outpouchings called diverticula, and its ability to stretch and contract properly can be impaired. These changes can lead to problems with storing urine and emptying it effectively, increasing the risk of infections and other complications. When urine cannot flow freely, bacteria can accumulate, leading to urinary tract infections. These infections can cause symptoms like burning, urgency, and cloudy urine. In addition, the buildup of minerals and bacteria can form bladder stones. The inflammation caused by infections and irritation may also affect nearby structures such as the prostate or epididymis, leading to further discomfort. If the obstruction persists or worsens, urine may back up into the kidneys, causing swelling called hydronephrosis. This can damage the kidneys over time and impair their function, potentially leading to kidney failure if not treated. Urethral strictures can also affect sexual health. Scar tissue and narrowing can cause pain during ejaculation, delay ejaculation, or even contribute to erectile dysfunction. Sometimes, the scarring causes the penis to bend or curve during an erection, which can be uncomfortable or problematic during intimacy. Overall, a urethral stricture disrupts the urethra's main role of guiding urine out of the body. It can cause local symptoms like difficulty urinating and pain, but also secondary effects on bladder and kidney health. Managing a urethral stricture early is important to restore normal urine flow, protect bladder and kidney function, and prevent further complications. From a bladder health perspective, keeping the urethra open and unobstructed is essential for proper bladder emptying. Chronic inflammation or infections related to strictures can also increase the risk of bladder irritation or injury, which might influence bladder health in the long run. While strictures are benign, ongoing irritation can sometimes lead to changes in the urinary lining that may increase the risk of bladder problems. Treatment options include less invasive procedures like urethral dilation, where the narrowed area is gently stretched, or internal urethrotomy, which involves cutting the scar tissue to widen the urethra. For more severe or recurrent strictures, surgical reconstruction called urethroplasty may be recommended. This involves removing the scar tissue and reconnecting healthy parts of the urethra to restore normal function. These treatments aim to improve urine flow, reduce symptoms, and preserve long-term urethral health. Always consult a healthcare professional if you experience symptoms of a urethral stricture. Proper diagnosis and personalized treatment are key to maintaining good urinary and overall health.